Okay, so today we're going to be learning about hypothyroidism. Okay, so here's a visual, and it's just to help you remember the signs and symptoms of hypothyroidism. Notice that the patient is going to be really cold. He's holding a bottle of body lotion because his skin is going to be dry. And just read through that, okay? And here are the late clinical manifestations in the orange box right here. And this is one of the drugs that you use to treat hypothyroidism, levothyroxine, Synthroid. On the left, we have a dose that is too low. The patient is basically going to have the same signs and symptoms as hypothyroidism because the drug isn't working. So everything's going to be low, okay, and slow. If it's too much, then the patient is going to have signs and symptoms of hyperthyroidism. So they're going to be really fast. They're going to be irritable. They're going to be having, tachycardia, diarrhea because the GI tract is moving too fast. Okay? And this is just a nice visual that will help you memorize that. Okay. So, hypothyroidism. Here's a video that's 3 minutes long that you can watch that will introduce you to the topic. Here's a video of a nurse, and it's 25 minutes long, and it's a bit long, so you can speed it up. And I set it to a speed of 2 that really helped get through the video a lot quicker. And here's another video they ended up finding later on, and it's of this other lady that's a nurse. And she also provides a quiz where she tests your knowledge on the material. And I just thought that was useful. So you can go ahead and look at that as well. And I would recommend that you look at those. Okay, introduction. I put this here because there's a learning objective that says interpret the negative feedback mechanism and its importance in the regulation of the biological processes. So basically, the way that this happens, the way that hypothyroidism happens, to understand that you need to understand a little bit of the patho. So ordinarily, the thyroid hormone helps speed up your metabolism. It keeps you warm, it keeps your heart rate up, and it does all these different kinds of things, okay? When there's not enough thyroid, this is what's going to happen. Your hypothalamus is going to send a signal to the pituitary gland, who's going to send a signal to the thyroid gland to release more thyroid. Here's a more in-depth explanation of that. The hypothalamus sends a message to the pituitary gland saying, oh, we need more thyroid. And you can see that in the picture right here. He's sending a message. And the name of the messenger is called thyrotropin releasing hormone, or TRH. Okay? The pituitary gland is going to be like, oh, okay, cool. I'll ask the thyroid gland to go make some, thyroid hormones. So the pituitary gland starts sending a message to the thyroid gland. And the name of this message is thyroid stimulating hormone, TSH. And that makes sense because the pituitary gland is stimulating the thyroid gland to make more thyroid hormones. Okay? And then the thyroid gland's like, okay, I'll give you guys some more thyroid, and he releases thyroid hormones into the body. The names of these thyroid hormones are T3 and T4. And you can see that in the picture, T3 and T4 is being released into the body. Hypothyroidism is when your body is not getting enough thyroid hormone for whatever reason. And we're going to go into that. Here are the different types of hypothyroidism. There are 3 types of hypothyroidism. There's primary, central, and central consists of 2 other ones, which include secondary and tertiary. And then the last type is cretinism. But I most likely think that they're going to test you mostly on primary and central. Okay. Which is why I emphasized more on those. Because the book only had like a few sentences on cretinism. Okay, now let's go into it. Primary hyperthyroidism. In this condition, the thyroid is the primary cause of the hypothyroidism. And that this makes up 95% of all the cases, and you basically lose your thyroid tissue for whatever reason, which is usually Hashimoto's disease, which is going to be explained a little later on. It leads to less thyroid hormone being produced, and it leads to increased release of the messengers from the pituitary gland asking the thyroid for more thyroid hormone, which is called thyroid stimulating hormone. And you should pay attention to this because there's a learning objective that says that you should know how to interpret the lab values and the diagnostic test used to assess altered function of the endocrine glands. Okay, so really pay attention to this. In the lab, the diagnostic studies will show you this, that one of these is going to be low, which is the thyroid hormone. Just the thyroid hormone is going to be low, but the TRH and the TRS are going to be are going to be high, okay? Okay, so the hypothalamus and the pituitary gland are working. The main problem is the thyroid itself, which is why only the T3 and the T4 are going to be low, okay? All right, now let's move on to central hypothyroidism. In this condition, the hypothyroidism is not directly caused by the thyroid. And there's two possibilities. If it's not caused by the thyroid, it needs to be caused by something else, right? Something different, okay? So the first possibility is that it's caused by the pituitary gland not working. It can't make or it can't release the TSH, which is the thyroid stimulating hormone that we discussed earlier, that stimulates the thyroid into making T3 and T4. So remember what I said, the learning objective is to interpret the lab values and the diagnostic tests, which is why I put this here. The diagnostic studies are going to show you that two things are going to be low. The T3 and the T4 is going to be low because the thyroid is not getting the message that it needs to release more T3 and T4, and the TSH is going to be low because the pituitary gland is the cause of this, because he's not releasing any TSH for whatever reason. However, the TRH is going to be high because the hypothalamus is working. Here's another possibility. Another possibility is that the hypothalamus is not working. Either it can't make or it can't release enough TRH. This is known as tertiary hypothyroidism, okay? And the diagnostic studies are going to show that all three levels are low. The TRH is going to be low, the TSH is going to be low, and the T3 and T4 are going to be low. So all three of them are going to be low, which might be a reason why they call it tertiary hypothyroidism. Three things are going to be low. And the secondary hypothyroidism was two things being low, if you remember. I'm just comparing and contrasting the two. Okay? And with primary, it was just one that was low, which was just the T3 and T4. So let's review this again. Primary, only one is going to be low. Only the T3 and the T4 are going to be low. In secondary, two things are going to be low. The TSH and the T3 and T4. Okay? In tertiary, all three things are going to be low. The T3, T4, the TSH, and the TRH, okay? All right. Now, this is just a one-sentence thing on cretinism, which was mentioned in the book, but I doubt they're going to test you on this one because there was literally only like a sentence on this. It just means that the hypothyroidism was present at birth, and they probably got it from their mom because, it's genetics and all that. Okay, that's what cretinism is. So in case you hear about that, that's what it means. It just means they had hypothyroidism since they were born. It wasn't something that just suddenly started happening. All right, now let's go into the causes of hypothyroidism. The reason I went into this is because there's a learning objective that says describe the risk factors associated with each of the endocrine disorders. So for hypothyroidism, it can be a result from chronic autoimmune thyroiditis, which is just it's like basically another word for this is Hashimoto's disease. Hashimoto's disease is when the immune system attacks the thyroid. It starts eating up the thyroid, and that's going to cause hypothyroidism because without the thyroid, you can't make any more thyroid hormones. And this is the most common cause, which is why I highlighted it. And I really want you to remember Hashimoto's disease, okay, or chronic autoimmune thyroiditis, okay? Another cause of hypothyroidism is the removal of a thyroid, which is called a thyroidectomy. Whenever you see ectomy, it just means removal. So thyroidectomy means removal of the thyroid. Another cause is radiation therapy. Uh, it can be caused by inflammatory conditions like amyloiditis, sarcoidosis. It can be caused by the pituitary failing and to produce the TSH. It could be due to hypothalamic failure. The hypothalamus is just failing and to produce TRH. It can be due to inborn errors of the thyroid hormone synthesis, like in cretinism. It can be due to medications, and I want you to remember lithium in particular. It's known for, a common side effect of lithium is hypothyroidism. Another one that would be good to know is amiodarone, okay? That can cause hypothyroidism. So some meds can cause this as a side effect. Another one is the inability to synthesize thyroid hormone because you don't have enough iodine in the body. Maybe you haven't been eating enough iodine. And the reason we don't get iodine deficiency is because we usually eat a lot of salt. Our diets are usually high in salt here in America. See, we add iodine to our salt. So most of the salt that we eat, it has iodine in it. And we usually have a lot of salt in our food. In fact, we have too much salt in our food. So not a lot of people, you know, should be suffering from any iodine deficiencies here in the US. So, hyperthyroidism affects women 5 times more frequently than men, and it occurs most often between 40 and 70 years of age. And the risk increases with age. So, if on a test question they ask, "Oh, this person is a woman and she's, let's say, 45 or 50," then you should know, you should think, "Oh, this person's at risk for hypothyroidism." And, if they start listing signs and symptoms of hypothyroidism, then you would know, hey, this person has hypothyroidism. Especially if they have a history of Hashimoto's disease. That's definitely going to make you start, making light bulbs click in your head and think, oh, hey, I got to be thinking hypothyroidism here. Okay. Now, let's go into the signs and symptoms, and I want you to keep this learning objective in your mind. You need to know how to compare and contrast the clinical manifestations and assessment of each of the endocrine disorders listed in the exemplars, okay? So, here we go. That's why it's important to know the signs and symptoms really well, okay? And here's a memory device to help you uh, think of all these signs and symptoms and attach them to hypothyroidism. So, hypo, it reminds me of hippo. And so I came up with this mnemonic. The cold hippo is fat and lazy, slow and low. Here's the explanation of the mnemonic. Cold is this hallmark sign of hypothyroidism. All values are going to be low with a person with hypothyroidism. The person's going to have a low heart rate, a low blood pressure, etc., etc. And I'm going to go more in depth about that later on. The only value that's going to be high is the fat, okay? And if you can see this picture, there's a really fat hippo, so you got to think fat, because the professor said in her lecture that she really wanted you to know that uh, fat is going to be, um, a hallmark sign of this. So their cholesterol levels are going to be high. They're going to have clogged blood vessels. So think atherosclerosis. They're going to have weight gain, and they're going to have a big puffy body. And the patient's body is going to slow down because the brain isn't getting enough blood. Remember what I said, that the values are going to be low, including the low heart rate and the low blood pressure. So what that does is it's going to decrease the perfusion in the body, and less perfusion means less oxygenated blood to important organs like the brain. So think about it. When the brain doesn't get enough oxygen, what's going to happen? You're going to have symptoms of that. The patient's going to have slow speech, and they're going to have slow thought processes. Okay? And that was the explanation of the mnemonic. And here's a picture to help you visualize that mnemonic. The lazy hippo. Look, it's a female hippo, and she's big. She's very big, and she's tired, and she's uh, really. I think of hippos as being low to the ground, and they're slow as well. So that might be something that might help you remember that. So here I go into detail of all the signs and symptoms of hypothyroidism. So hypothyroidism, think fatigue. They're going to be fatigued. They're going to be cranky. They're going to be irritable. That's because their brain's not getting enough oxygen, as I explained earlier. There's going to be a loss of libido, a loss of sex drive. They're going to have hair loss. And look at the hippo. The hippo doesn't have any hair, okay? So that might be something that might help you remember. They're going to have brittle nails. They're going to have dry skin. Their fingers, they could have numbness and tingling in their fingers. They could have a hoarse voice, and they could have menstrual problems. Because remember, this usually happens in women. So a sign and symptom is menstrual problems. Severe hypothyroidism is going to be characterized by really, really, really low temperature. So this is something that you just have to stick in your head. Low temperature, cold equals hypothyroidism. So in severe, it would be really low, and they could even go into hypothermia. Okay? They're going to have a low heart rate. So that's bradycardia. They're going to have some unexplained weight gain. Their face is going to be puffy. Their hands are going to be big. Their feet are going to be big. They're going to have periorbital edema. They're going to have a goiter, which happens in both hyper and hypothyroidism. So it's not a good identifier, but it's good to know, okay, that people with these hypo or hyperthyroidism are going to have goiter. Okay, they're going to have a big tongue. Okay, it's going to be big and swollen. They're going to have high cholesterol levels. Remember, everything's going to be low except for the fatty stuff, okay? So cholesterol levels, that's fat, okay? So it's going to be high. And what happens when you have high cholesterol levels in your bloodstream? Atherosclerosis. So their blood vessels are going to be getting clogged up, okay? And that puts them at risk for CAD, okay? So that's going to put them at risk for heart problems, okay? So they're also going to have thick skin. They're going to have a blank face, and that ties back into the blood, the blood not getting to the brain, so the brain's not getting enough oxygen, okay? So they're not going to be able to display any emotions. They're going to look very apathetic. They're going to have a dull mental process, okay? Everything's going to be slowing down in the brain because the brain is shutting down, okay? Their GI tract is going to be really slow, and what happens when the GI tract is slow is that the poop that's in there is going to stay in there for too long, and it's going to all the water is going to get sucked out of the poop, and that's going to lead to constipation. Their speech is going to be slow, and again, that ties into the brain not getting enough oxygen, and they're going to have a decrease in their mental stability. Okay? So the brain really, really needs oxygen. And if it doesn't get what it needs, then everything's going to start to shut down. And you're going to be, and it's not going to be happy about that. In the worst case scenario, you're going to get a myxedema coma. And I want you to memorize that, because this is a disease. I mean, this is a symptom. This is a condition that occurs in hypothyroidism specifically. It's very specific to hypothyroidism. So this would be a good test question to see if you can find the disease the the condition that is specific to hypothyroidism. Like, for example, what would most likely this patient be? Uh, what condition would this patient be most likely to have? And then the answer might be myxedema coma. Or they could just give you the signs and symptoms and ask you what it is. Okay, so try to memorize these signs and symptoms. So just think all the signs and symptoms that we've already talked about, except they're going to be more extreme. So earlier we were talking about how the brain wasn't getting enough oxygen, so everything was slowing down. So in myxedema coma, they're going to just go unconscious because their brain is like, I give up. You know what? You haven't been giving me oxygen, so I'm shutting down here, okay? They're going to have really low temperature. They're going to go into hypothermia. They're going to go into low ventilation, okay? They're going to go into hypoventilation. Without the brain uh, receiving enough oxygen, it's going to shut down. And when the brain shuts down, everything else shuts down, okay? So they're going to have a low pH, and they're going to go into respiratory acidosis. They're going to have low blood pressure, and they're going to go into hypoglycemia because the brain has eaten up all of its sugar. They're gonna have low sodium levels, they're gonna have low blood pressure, and they're gonna have a low pulse. And the low blood pressure and the low pulse, are what's causing these brain problems, okay? So here's another learning objective. Evaluate the medical and nursing management for patients with alterations of the pituitary gland, the thyroid, the parathyroid, and the adrenal glands. So let's look at the medical management. We as nurses, the focus is mostly nursing considerations, so I emphasized more on nursing consideration, but I just wanted you to touch base on the medical management just so you could be a little bit knowledgeable about that. So basically, when someone has hypothyroidism, you're just going to replace the thyroid with levothyroxine. Another name for that is Synthroid. That's the brand name, but I think on the NCLEX they're going to they're going to test you on the generic name. So I would rather have you memorize the generic name, which is levothyroxine. And supposedly they're supposed to be using only generic names from now on in the nursing program, but you never know. So just in case, just to have that in your mind that Synthroid is the brand name. But mostly the focus is that the generic name is levothyroxine, okay? And you just treat the myxedema coma, you support the vitals, and you support the blood pressure, the pulse. You're going to try to get that up, because if you get that up, then the brain's going to get enough oxygen, and then that's going to create a domino effect and help, the patient significantly. So yeah, really try to bring that blood pressure up and that pulse. They're going to get IV levothyroxine, hydrocortisone in cases of pituitary and adrenal insufficiencies. And if they're hypoventilating, and if they have hypoventilation, then you're going to have to give them some oxygen support and respiratory support, okay? And you're also might include fluid replacement to try to get that blood pressure up. and antimicrobial medications in case the cause is some kind of infection. All right, let me make sure. All right, now let's go on to nursing management. All right, and remember, keep this learning objective in mind that you need to know the nursing management for this patient, okay? And as nurses, this is what's most important for you to know, okay? Of course, causes, signs, and symptoms are really important as well, but also know what you're supposed to do, okay? So, this is what the professor said. You know, you're going to replace the missing hormone, you're going to prevent the disease from progressing, and you're going to try to prevent the complications. With regards to pharmacology, you're going to give them the levothyroxine, as I said earlier, which is why I highlighted it, because I really want you to memorize that generic name. And the dosage is based on the patient's TSH levels. If the disease progresses to myxedema, they're going to give it through IV because you want that drug to act as quickly as possible. And there's also a side note that that prevention of cardiac dysfunction is important, and it's important to avoid medication interactions. Supportive therapy, vitals, basically. Vital functions should be maintained. You need to be checking the ABGs because, like I said earlier, they're going to go into respiratory acidosis. Monitor their O2 stat levels, and you administer fluids cautiously because if you administer fluids too quickly, you can give them some water intoxication. And also give them some passive rewarming because if you just these patients are going to be really cold. So imagine if you go outside to play in the snow, your hands are really cold. What do they usually tell you to do? They tell you don't just go in and put your hands in hot water because you're going to burn yourself, okay? So you're not going to be using any electric blankets with these patients because they could burn themselves, okay? Nursing management, continuity of care, you educate the patient. If the cause was iodine deficiency, you teach them on diet and you set them up for a follow up. And here's some things from the Nursing Made Easy book that I wanted you to look at. So, what you do when when they have hypothyroidism is you provide a high bulk, low calorie diet and you encourage activity because remember these patients have this enormous weight gain, and I know it doesn't happen for all patients with hypothyroidism, but with regards to this lecture, the professor really stressed this out that the patients are going to be fat, fat, fat. That's what she said. So that's something to keep in mind that you need to put them on a low calorie diet, okay? And again, just think about the hippo. The hippopotamus was fat, right? So would you give the fat patient any high calorie foods? No, you would give them a low calorie diet, okay? You administer stool softeners because they're having the constipation. You replace the thyroid, and you have to watch out for the signs and symptoms of hyperthyroidism, okay? Because if they take too much thyroid, that's a possible complication. And some of the signs and symptoms are restlessness, sweating, and excessive weight loss. Advise the patient how to obtain a medication identification jewelry, okay? And evaluate the patient. She should have normal bowel elimination and good heart function. Um, Basically, just make sure that all the vitals went back to normal and make sure they get that little jewelry on their wrist or wallet, or get them a little identification card or something that lets people know, hey, this person has hypothyroidism, okay, in case of an emergency. All right. Um, let's see. These are some good tips to teach the patient. You tell them to report any heart problems like chest pain, tachycardia, or teach them that they should prevent myxedema, coma. They should continue their medications even if the symptoms subside, and you instruct the patient to report infection immediately and to make sure any health care provider who prescribes drugs for him knows about his hypothyroidism. And here's a nursing alert. The nurse must monitor for myocardial ischemia or infarction, which can occur in response to therapy in patients with severe long-standing hypothyroidism or myxedema coma, okay? The nurse must also be alert for signs of angina, especially during the early phase of treatment, okay? So, if detected, it must be reported and treated at once to avoid a fatal myocardial infarction. So, a really big concern is the heart, okay? So, keep that in mind. Myxedemia coma, watch out for that heart. Okay, so for the management of myxedema coma, that's an emergency, it's a medical emergency, and it oftentimes has a fatal outcome. It happens gradually, but sometimes stress aggravates the condition, and then they can suddenly go into severe myxedemia coma, okay? So, examples of severe stress are things like infection, cold, or trauma. They could suddenly stress them out and put them into a coma, okay? Other precipitating factors are things like withdrawals from medication, like suddenly they stop taking their meds, and the use of sedatives, narcotics, and anesthetics. And I want you to remember that because they even put a nursing alert right here where they say, warning, these people are gonna be sensitive to sedatives and opioids and anesthetic agents, so they must be administered with extreme caution. So if you see that this patient is a hypothyroid patient and you see sedatives on their list of medications, you should be like, hey, I should really question the doctor about this one because that's really, dangerous. That like, it's really, you really got to be careful with that. So really make sure that the doctor knows what he's doing if he ever prescribes these sedatives to this patient. Okay, because you're the eyes and ears of the doctor and you're going to be held legally responsible if anything happens. So that might be a good idea to follow up with the doctor and be like, hey, I noticed that this patient's on a sedative and he has hypothyroidism. So yeah, just wanted to bring that up, see what was the rationale behind that. So, and they put this in the book. They said, nursing alert in all patients with hypothyroidism, the effects of analgesic agents, sedatives, and anesthetic agents are prolonged. Special caution is necessary in administering these agents in elderly patients because of concurrent changes in liver and renal function, so they won't be able to excrete this drug. Okay? Which adds to the fact that in hypothyroidism patients, they are already excreting these drugs at a delayed rate, okay? So these drugs are going to stay in the system for a really, really long time, especially in patients that are old and that have hypothyroidism at the same time. So I would really question that order if I were to see an old hypothyroidism patient with a sedative on their medication list. Okay, so back to what I was saying about patients with myxedema coma. They have they have significantly depressed respirations, so um, you really gotta be monitoring their respirations. Okay, their ABGs. You gotta be checking their cardiac output as well because it's gonna get worse. With a myxedema coma and the cerebral hypoxia is going to be pretty bad, okay? So remember what I said. If it's gotten to the point where it's at myxedemia coma, this brain has been asking for oxygen for a very long time for it to, just suddenly be like shutting down. Okay, so watch out for that. You need to be watching, be thoughtful of that. Okay. The patient is often stuporous and hypothermic, okay? Their vital signs will reflect bradycardia and hypotension. Here's some life-saving interventions. If the patient becomes comatose, begin these interventions as soon as possible. So ASAP, quickly, get on this. Maintain the airway patency with ventilatory support if necessary. Maintain circulation. Give them IV fluids. Provide continuous ECG monitoring. Check their ABGs. Detect hypoxia and acidosis, okay? Warm the patient. Wrap them in blankets, okay? Don't use the electric warming blankets, okay? Because um, this is going to increase the peripheral vasodilation, which is going to cause shock to the patient because this patient is already getting low perfusion to the vital organs like the heart and the brain. So if you suddenly put some really hot, burning hot blanket on them, like an electric blanket, then that's going to dilate their peripheral blood vessels and get less blood to the vital organs. Monitor the temperature until it's stable with a low reading thermometer. Replace the thyroid hormone with large IV levothyroxine doses as ordered. Monitor the vital signs because rapid correction of the hypothyroidism can cause adverse cardiac effects. Monitor the intake and output, the daily weights. With treatment, the urinary output should increase and body weight should decrease because remember, these guys are really puffy and big, and a lot of that is water weight and water retention. So you want to make sure that that's getting excreted. And as that is excreted, the body weight should decrease. And if it's not decreasing, then you need to tell the doctor about that. Replace the fluids and other substances such as glucose. Monitor serum electrolyte levels. Administer corticosteroids. And check for possible sources of infections such as the blood, the sputum, or urine that may have precipitated the coma because remember, as we said, these are usually precipitated by stress. So whatever's stressing out the body, if you can correct that, then that would help out with the myxedema coma. So treat the infections or other underlying illnesses as ordered. And then again, like the warning sign, the sedatives, okay? So really keep that in your head. If you see a patient that's old, has hypothyroidism, and that's on sedatives, opioids, or anesthetic agents, then you're going to really have to bring that up with the doctor because this patient is going to have a really prolonged effect of that drug. And here are some hypothyroidism practice questions that I would like you to go over, okay? So the client is diagnosed with hypothyroidism. Which signs and symptoms should the nurse expect the client to exhibit? 1. Complaints of extreme fatigue and hair loss. 2. Exophthalmos and complaints of nervousness. 3. Complaints of profuse sweating and flushed skin. Or 4. Tetany and complaints of stiffness of the hands. And then you can scroll down and see the answer. And you can take your time taking these. I got them from different sources. The first one was from the MedSearch Success. Q&A review, applying critical thinking to test taking skills. The second one was from the study guide of the Burner and Searles textbook. This study guide didn't really make much sense, but this one and this one is the best ones. The first column and the third column. Okay, that would really help you with, applying your knowledge. Take that, please. And that ends my lecture.